Good afternoon, everybody. Welcome to the pre-Hacking Health Amsterdam session today. It's good to see so many faces. I think a lot of you will also join a bit later, but for now, I think due to the time, it's good to get starting. So good afternoon. My name is Najwa Rian. I am Policy Officer at the Research Institute Amsterdam Reproduction and Development. And together with preHHA2021, who's in charge of communication and design at the Research Institute Amsterdam Public Health, and Lisa Boom and Marta Luijtjens, who are two amazing management trainees, we have organized this event. We organized this event because Amsterdam UMC is proud partner of the event Hacking Health Amsterdam ever since 2019, when this event was initiated. And I think the title of this event might be clear to some, but not to others. So we thought it would be a good idea to organize this session to inform everybody about what Hacking Health Amsterdam is. And hopefully at the end of this afternoon, everybody will be very enthusiastic to join this year as well. As this slide also mentioned, this session will be recorded. Some people were not able to join, but are still interested in this information. So be aware of this. I think mostly the presenters will be recorded and maybe audio if there are any questions. So for now, let's start. I will show you the program of today. We are very proud of the program that we're going to share with you today. It's very diverse. First and foremost, we will give the floor to Martine de Bruyne and Rob van der Kolk. They are both part of Amsterdam UMC and Martine from the Research Institute Amsterdam Public Health. They're also both part of the steering group of Hacking Health Amsterdam. So they will share light on why they became partners of this event. Later on, I will give more insight in what the event is, so what you can expect from this hackathon. Then Vanessa Scholtes will share her experience. She has participated as a hacker in 2019 with Hacking Health Amsterdam, and she was so happy with the event that she also decided to become our new project leader this year of Hacking Health Amsterdam. She will share her experience, and afterwards there's also time for a Q&A. So if you have any questions, don't hesitate to ask us, and we will try to get back to you with the proper answers for that. And last but not least, we also have a little workshop for you, which will be hosted by Frederike Vries. She has also been part of Hacking Health Amsterdam since the beginning. She's also worked within Amsterdam UMC, and she will do a workshop titled Power to the People, and it's on human-centered design thinking. So for now, I would like to give the floor to Martine de Bruyne and Rob van der Kolk and hear why they partnered up with Hacking Health Amsterdam.
Oké, ik weet niet of ik nu meteen in beeld ben, maar dat zal Najwa dan eventjes tegen mij zeggen. Ik denk dat gaat helemaal goed. Fantastisch. Welcome everybody. I just discussed with Martine that I would start with the introduction of us and why we joined Hacking Health Amsterdam. As Najwa said, I'm Rob van der Kolk, not only part of the partner in the steering committee of Hacking Health, but also director of the Heart Center of the Amsterdam UMC. And well, we as a hospital have huge challenges at this moment in healthcare, the coming years. Currently, 1 out of 7 people working in the healthcare sector. And if our system of delivering healthcare stays the same, we need about 1 out of 4 people working in healthcare in 2040. And this is not feasible. It's not affordable. And therefore, we need innovations. Innovations that are based on working together and crossing boundaries of today's institutes. Most of the innovations in healthcare today are innovations in a small niche. Innovations on a really specific field, or for a rare disease, or focused on only one aspect. And these innovations are often related to technical innovations. And although hacking seems to refer to technical innovation, this event is not. It's much more a design and a networking healthcare innovation event. And you'll hear from that much later. It's an event where you're stimulated to look at a problem from different perspectives and different angles. And I was thinking about it last month. Edward de Bono died. And no, De Bono is not the lead singer of U2. Edward De Bono is the originator of the word lateral thinking. And in change management or creative thinking, he's known for his colored hats. You put on a colored hat on your head and you're asked to think conform the rules of the color. A green hat has to grow new ideas. When you put up a blue hat, you see the big picture from both in the blue sky. A black hat, of course, is a bit of the negative and the dark side of things. And if you put your bright yellow hat on, the sun is shining the whole day. During the Hacking Health, you'll meet persons with all those different colored hats on. And using those different hats or different perspectives, if you use them well, you will result in another type of innovation. Not a niche innovation, but an innovation across fields. An innovation that will combine things and will bridge different fields using the different perspectives as a strength. And I'm personally convinced that most of the possibilities or improvements in healthcare lie just in between healthcare departments, in between organizations, in between the institutes. And as I know, most of the people in this event will have a yellow hat, the ones where the sun is always shining. And that's why this event is also a very fun event. It's full of energy and there is a lot of good, great vibe. But don't forget the other colors. The innovative breakthroughs might just as well coming from the other corner, from the green, the blue, or maybe even the black hat. We, from the management of Amsterdam UMC, greatly support this event and its outcomes. We support it by finance or moral support or just having a chat. So I hope a lot of people will join. Build a nice network of great people working together for the same goal to make Amsterdam, and I think the world, a bit healthier. Thank you.
Thank you, Rob, for your inspiring words and also emphasizing the fact how important it is to work together with different types of people during the hackathon and also in the rest of life. So now I would like to give the floor to Martine de Bruyne.
Thank you. I'll share my slides. See how it works. I have just 3 slides, but I think it's helpful. So thank you for the invitation to give a small pitch why Hacking Health Amsterdam is so important for our Institute Amsterdam Public Health. Our mission is health for all, powered by science. And as a research institute, we form part of Amsterdam UMC, but we integrate the VU University and the University of Amsterdam in our work. So we are a big group of researchers, and we try to integrate healthcare and social care, and actually to substitute curation by prevention. And we do so not only as a research institute, but beyond generating knowledge. Oh, what happens with my slides? I'm sorry for that. Beyond generating knowledge, APA supports translation of scientific knowledge to daily practice. See if I can get the slide up again. Doesn't work well. Oh, I need to go. Sorry for that. I have 2 computers. It's not using. So the Dutch people live longer than ever before, and this does not apply to everyone. For instance, people with a low socioeconomic status die 7 years earlier and have 18 healthy life years less compared to others. This is not only a growing gap and very unfair, but it's also an opportunity to improve public health, to work on these gaps in health. And this is not easy because health is determined by many interacting factors such as nature, nurture, environment. So if you want to improve health for all, we really need to solve a complex problem, and we need to collaborate between many experts, as Rob already told us, from science and from society. And this is exactly what Hacking Health Amsterdam does. So really, we are very happy that it's organized and we can participate in it. So in 2019, and that's the next slide, researchers participating from our institute were very enthusiastic. They experienced how intensive collaboration with new experts from different backgrounds resulted in unforeseen and even prize-winning innovative products. Researchers felt they could add value in new ways and outside of the university, and they were respected by others when they did. And the picture shows Hartmaatje. It's gone again, the picture, but it's a beautiful card box to invite your peers and to help you after you have had heart disease. It was planned to be an app, but the team found out that a simple paper card box was much more suitable and powerful, because it helped you to have a face-to-face conversation both with the doctor who explained to use the card box, but also with your peers, which you invite personally to help you to change your lifestyle after the operation. I think this is a great example of how design can be a simple way or can help to find simple solutions for very complex problems, to inspire you to feel strengthened for your career after your research career or any other career, because there's so many places in society where you can be valuable in improving health for all. So I wish you a very inspiring Hacking Health Amsterdam, and hope on many brilliant new ideas also for this round. Thank you very much.
And thank you, Martine, for your presentation. We're very happy that the Research Institute is so greatly linked to this event, and great to see that there are also prototypes already existing because of this. So we've talked about the hackathon already quite a bit, but what is it exactly? Well, I think visuals speak louder than words, so we have a small video for you to show. So in a few seconds, my colleague will share her screen, and after that, I will go more into detail about the event.
Door middel van zo'n evenement die innovatiekracht in de sector gaan vergroten. Het unieke aan Amsterdam is dat we hier verschillende partijen bij elkaar samenbrengen in de zorg- en welzijnssector, maar ook tussen publiek en privaat. En je ziet dat die samenwerking echt hele mooie kruisbestuivingen oplevert.
Als ik zie wat mensen aan kennis ophalen, wat ze gebruiken, mensen van buiten halen, mensen van ontwerpers tot en met welzijn, tot en met verpleeghuiszorg. Ja, ik ben diep onder de indruk. Dus één woord: fantastisch.
Op het moment dat je binnenloopt, dan voel je al de zinderende energie en echt het bruist hier gewoon. Dus het deels de locatie, maar vooral ook de mensen die hier bij elkaar zijn gebracht. Gewoon 20 teams die allemaal heel creatief bezig zijn met een mooi vraagstuk.
Van deze hackathon echt geweldig. Ik denk dat het nodig is om echt stappen te maken naar een betere gezondheidszorg als je gebruik maakt van elkaars expertise, als je kijkt in elkaars keuken en als je elkaar enthousiasmeert.
Ik vind de Hacking Health Amsterdam energiek, omdat we hier zijn met heel veel verschillende mensen. En dat we echt vanuit de bewoners van Amsterdam, zou ik maar zeggen, dat we vanuit daar kijken naar de vraagstukken. En die bewoners die lopen hier ook letterlijk rond om ook te kijken van, nou ja, ben ik straks geholpen met die oplossingen?
Ik heb echt een topteam en we hebben zo'n goede pitch neergezet. Dus ik ben totaal voldaan. Ik ga echt als een blijer persoon straks naar huis.
Volgend voorjaar 2020 is er weer.
I think I've seen this video many times, but I still smile every time that I see it. Just the energy and so many people working together. Hopefully we'll be able to do that this year as well on location. So now you've seen a few clips of 2019 when we had the Hacking Health Amsterdam on location. And now I will share some slides to tell you a bit more about the event. Yes, so what is Hacking Health Amsterdam? Disclaimer, this year it will be on the end of October, so 28th, 29th and 30th of October. Already set a date in your agenda, don't forget about it. It's the hackathon for a healthier and happier Amsterdam. The goals of the hackathon is to go from ideas and challenges to prototypes. And it could be very different kind of prototypes. Like Martine already said, some research from her research institute had like paper cards that were the prototypes, and other people will invent a dashboard or a technological structure. It can be very diverse. And I think the greatest part of the event is that you work together in multidisciplinary teams. So people from various sectors are involved. You'll be in a team with somebody from IT, maybe a student, maybe a citizen of Amsterdam. Everybody brings in their own perspective and their own expertise to together solve a problem within 3 days. Here is a quick overview of how the hackathon works. Before I go into detail, it's very important to know that there are 2 different types of roles you can have within the event. You could be a pitcher or a hacker. And I will start with what the pitcher's role will be within the event. A pitcher is the person who has an idea, a problem, a issue, situation he or she would like to get resolved. It's something he or she sees in everyday life and would like to solve, but doesn't know how to do that. That person with an idea can let us know that they have that idea, and they can join some of our previous workshops as well to investigate how, what's the real problem behind this problem? Who does it concern? How big is it? That way you can also look at the stakeholders. So when they have thought of that idea and the stakeholders, they can register at our event and let us know that he or she would like to solve it. And then at the event, the first day, the pitcher will pitch its problem. So the thing that he or she would like to have solved. And then the hackers can sign up for the pitches they think most fits their experience or expertise. And together they can hack this problem. So the hacker comes in at the first day of the event to join the pitcher. So the hacker itself does not need to have a problem or issue he or she would like to resolve. The hacker just has to be a very enthusiastic person who would like to join people to solve a problem that will benefit the health and happiness of Amsterdammers. So the teams will be formed after the pitchers have pitched and the hackers have signed up for the pitches they would like to help. And during the 3 days of the hackathon, they will try to solve this issue. We as Hacking Health Amsterdam will try to facilitate the hackers and pitchers as much as possible to solve their problems. So during those 3 days, we will organize workshops to really get to the bottom of the problem. We will also invite different types of coaches and other experts to maybe shine a light on the issue from a different perspective as well. So during those 3 days, you will get so many insights of different people, but you also get the tools during the workshops how to be a problem solver together in a team. At the end of the 3 days, the teams will present their solutions, and there are also going to be some winners. 2 years ago, we also had a national finale. So the winners of our Hacking Health Amsterdam will also be able to join the national finale. For now, I'm not sure if that's gonna go because of the Corona situation, but even this, it's always great to just have this solution with your team. Doesn't matter if you win a prize or not. So this is in one quick overview how the hackathon works. But I think it's even better to hear it from someone self, how the hackathon is and what the experience is. So that's why I would like to introduce our next speaker, Vanessa. Like I mentioned in the beginning of this meeting, she joined Hacking Health Amsterdam in 2019 as a hacker. So she wasn't somebody with an idea, she just wanted to help. And I'm very curious to hear how she experienced the event. So Vanessa, the floor is yours.
Well, thank you. And first of all, thank you for inviting me to share with you all my experience, because I never waste a moment to talk about the hackathon, because I think it's one of the greatest things I have participated in my professional career. So I've joined many conferences, etc. But that's always like you listen and you hear and you gain knowledge, you network, you meet some people. But the hackathon is really something else, because you're just full in. And I think I joined the first. Well, I know I joined the first hackathon in Amsterdam in 2019, but I really didn't know what to expect. So I went in fully blind. I didn't know what a hackathon really was. I was a bit scared because I thought it was a really technical event, and I don't know how to code. I don't know how to make software. And I thought we really have to make some technical things, but it really turned out that it was really the right place for me to be, because I met so many people just like me who didn't know at that time what they were going to expect for those 2.5 days. But everybody was really roused up during the whole hackathon. And I think first of all, it's because the organization is great. It's a really good, solid organization. Like today, the program here, I think a big compliment to your organizing committee that you're really lucky with, because they are, all 4 of them are so exciting to, persuade you all to sign up and join in as a hacker or a pitcher, that they organize this event, or now, but the hackathon is in October, so it really takes some more months before we can really participate in the hackathon. But well, the preparation has started, especially by your team, and from the 1st of August, I think the pitches, I don't know what it's called, but the lines are open for you to bring your pitches to the organizing team, and they can help you to really polish that into a great pitch for the hackathon. So the fact that you already started now, since it's July, is a great compliment for your organizing committee. And I just want to tell you, like what Rob said and what Martina said and Najwa, I think everybody already gave a really great introduction, and I can only agree with everything that's been said. It's the relevance is I think clear. We have a social relevance, health relevance for this event. We have major challenges for our health in the future, and we need good solutions. And I work in the OOVG, and in the OOVG, I also started as a researcher. But now I'm more in innovation and process optimizations. And what my experience is in the OVG, like I'm always very excited and always believe that we can time. You only have 2.5 days, and after 2.5 days, you have a solution. You have a prototype. There are no boundaries. There is no can't do attitude. It's a really can do attitude, and everybody is really like in it for a success. So everybody is like rolling up their sleeves, like, okay, what do we need to do? Do we need to find stakeholders for our problems, to test if we are like working on the good solution? I remember that I just ran out on the street to find talk to Amsterdam people walking in the street and just stop them and say, oh, please, can you spare 5 minutes? And we ended up with talking to 30 just random pedestrians. And everybody was really like, gave us really good feedback and information to really make sure that we had a really good prototype at Saturday, which we didn't win, not nearly, but it didn't matter. Like Mathieu said, it was just really exciting to have that experience. And I think that is, for me, the best reason why you should participate in this hackathon. It's great that you get your support from your institute, from your employer, and use it, because when you are working now as a researcher or in the hospital, whether you're a caregiver or working in IT, you're always part of a small team, and you have most of the time you're working on one job, and it most of the time takes a long time before you finish something, and the experience that you can have in the hackathon really gives you a new revised energy that you can bring back the next day you get to work. Because the Monday after the event, I was on my bicycle and I was really smiling, and I was so excited to go to work because I thought, wow, I need to tell this to my colleagues. And what I'm not going to do, I'm not going to present my idea to another board. I'm not going to do it. I'm just going to find the people who are just excited as I am, because that's what I really found out, that if you have a good idea and you believe in it and you talk to other people about it and they are just as excited as you are, great things happen, and they happen really quickly. And it doesn't matter if you fail, because we failed massively, but we learned so much from the mistakes that we made those 2.5 days. It was like a roller coaster, like up and down and up and down, but always trying to make it better and improving our solution that we have, because we believed in the problem and we believed that we had to find a solution. So I think that's the energy that we saw in the promo video. That's true. That's not fake. It really was so energetic those 2.5 days. So it's just not the lucky shots. It was like, I don't know how many hours the hackathon was, but like 150 hours. It was 150 hours of full-blown energy. It was really great to experience that. And if you think about, do I want to participate as a hacker or do I want to participate as a pitcher? Maybe you can just talk to us and we can help you, because I participated as a hacker, but when I was there, I thought, oh, I should have been a pitcher, because in my job, I experienced so many problems. And these are just problems that I can really get some help with, and should have asked for help. Now I'm here. So I wasn't used to asking help, but what I saw from the hackathon is just, it's so easy to ask for help, and it's so easy to find people who can really help you and build your team with people you never met before. But yeah, it was just really good also for me afterwards to think, okay, next time I will participate as a pitcher. But now I'm in the organization team, which I'm more proud of as well, because yeah, I think this is just such a great event. And I think the fact that I don't know how many are in this first meeting now, pre-hackathon, but I think it's over maybe nearly 40. And I think that's a big compliment, and that shows the enthusiasm, I don't know the English word, enthusiasm, the energy that you already have in your institute. So just hold that and just sign up as soon as the lines are open, because it's going to be a great event, I know.
Thank you, Vanessa, for sharing your experience with us. So for everybody who's joining us today, if you have any questions, you can put it in the chat and we can ask Vanessa or somebody other from the team and maybe answer that for you. To kick it off, I would like to ask Vanessa, could you maybe share a bit more about the issue or the problem that you tackled with your group during the hackathon?
Oh, yes. Well, my group, it was, I don't know the English word, but
Vanessa, sorry to interrupt, you're on mute.
I can unmute myself, yes. No, my pitch was, I don't know the English name, it was APK for every Amsterdammer, and I think it's like a general health checkup. So that was the problem that we hacked, and it was quite difficult because we found out there were already general checkups available, like commercially or non-commercially. So we spend a lot of time in, but how do we know what elements of the checkup are really important for the Amsterdam patients? And so that's why, in my example, that we went out on the street and talked to pedestrians to find out, okay, what is their fear about their health, and what are the elements that need to be in such a checkup. So that's the problem, and we finally hacked it with more like an well, it ended up with a coach, but our solution was not finished yet, but the problem was really clear. And I think the example that you saw from Martina from the Hartmaatje, that was really a nice well, the problem was clear and the solution was really nice, because they already made a nice box with the cards and they really could show a nice prototype. And we also saw some nice working apps. So we had some good technical students who participated, and we had like all these different types of solutions for problems that were really cool.
Great, thank you. I think that's also something that's very nice about the event, that with the problem that you come in the first day, it can be totally different on the third day, because you make a shift by talking to different people and then you change perspective on that. So either way, you're gonna learn something new and maybe find a solution to a problem. I don't see any other questions left in the chat. So if anyone ever has a question about Hacking Health Amsterdam, you can always send us an email at hackinghealth@amsterdamumc.nl. And I think for now, we should have a quick little break. It's 4:06, so I think we should regroup at 4:10, because then Frederike Vriends will give us a workshop. So see you. Okay, welcome back, everybody. Hopefully you've had some time to grab a quick drink or maybe go to the bathroom. And now we will start with the second part of the session today. And I would like to give the floor to Frederike Vriends. Like I already mentioned, she's also part of the Hacking Health Amsterdam team, and she's going to give a workshop to you today titled Power to the People. So Frederike, take it away.
Thank you very much. It's really nice to be here. And maybe you saw my face in the little video earlier. It was always really strange to see yourself. And I'm going to give a workshop about human-centered design thinking, and it's all about humans or people. And actually, it's really weird not to see you because you have all your videos off. So for me, it would be really nice to quickly see all your faces, so I can have a little look at all the enthusiastic people at home who are watching and who are interested in human-centered design thinking and the hackathon. That's really nice. And maybe it is possible that you wave when you know already a little bit about human-centered design thinking. Oh, there's one wave. But yeah, lots of people for whom it's really new. So I'm going to give you a little bit of an insight of what it is and why we use it. I'm going to open my share screen and my PowerPoint so you can have a look with me. And I have to put it on full screen. I'm going to look at Geertje Marije. Can you see my PowerPoint presentation? Just for a check. Yes. Perfect.
Jazeker.
Thank you. Well, first of all, I'm going to start with a short introduction of myself, so you know a little bit more about who I am and why I'm so passionate about the hackathon and also about the method we use during the hackathon. So this is me on the stage of the first hackathon with Esther. Esther and I met just after I left VUMC Hospital. I worked there for 8 years in different positions. The last role I had in the hospital before I left was manager strategy and innovations. But I wanted to contribute more to the whole region, not just in Amsterdam, but also on a nation-wide level. So I started working for myself. And one of the things I started was working together with Esther and organizing the hackathon. And this is us on the stage. The first day we were really nervous, but we had some great days. I'm trained originally as a clinical neuropsychologist, but I'm also a consultant. I worked in a consultancy firm for a while. I worked as a manager. I'm an entrepreneur. I'm a change agent. I'm a mom. I'm an out-of-the-box thinker. I'm a connector. And I think most of all, I'm Alice in Wonderland, because I'm very curious about the world and the people in it and how we interact with each other and how we live and stay happy. And I use all these words, and it's probably not enough because I have so many roles and I'm always more than just one. And that's where it starts. We're all human and we have all different roles. And that is really important when you start finding solutions for humans that humans use or humans have to interact with. You have to know who they are, and they're not just one person, they're more than that. So what are we going to do today? Let's see. Oh, no, it doesn't go to the next slide. Yes. We're going to talk about transforming healthcare and the importance of human-centered design thinking in it. I'm going to tell you a little bit more about what human-centered design is and how you use it. And we're going to practice, and we're going to ask some questions, have a conversation, share your observations, etc. So first of all, transforming healthcare. I'm going to start with the empty slide. We are in a phase that, and probably all of you know it, there's so much going on in healthcare. We have to make a shift from treating ill people to taking care of health. We have to make sure that the health care is given on the spot where it's most needed. So maybe it's with the primary physician, maybe it's in the hospital, maybe. So we're changing a lot, and it's getting too expensive. So we have to look at the costs. We have lots of new technologies. So lots of things are changing, and it's not just a small change. No, I think it's a transformation we're in. And when you start transforming, you start with a dream. This is in Dutch because it's a model I use more often, so I couldn't translate it anymore. But we start with a dream. We start with a regional vision, a regional goal about where we want the healthcare to go to. And we do that together with all the people around us. So you never do that alone. You formulate a dream, you formulate a vision, and you do that with all the people that are important around the patients and also with the patient. And if you have a dream, you have to have decision makers to carry that dream and to show leadership and to adjust their governance structures between hospitals or between different players in the healthcare system, because they have to carry that dream and make it, and have to take the first steps to transform that healthcare. And then you have to design the solutions that contribute to that dream. So what are the solutions? And designing alone without working on a dream is nothing. Also, designing without the support of the decision makers is also not enough. You have to have all of them. And it's really important to make sure that, importantly, the people who are experiencing the problems in real life are the people that you have to take in account when you start designing the solutions, and you have to know everything about them. And if you have a nice solution or a prototype, you have to do it. You have to make sure it's being done in real life. You have to implement it, and that's also really difficult. And implementing something, and when there's no support of the people who use it, it's not working. Implementing without support of the decision maker is not working. And implementing without knowing what it contributes to the dream is not possible. So it all connects together. And then in the meantime, you're constantly learning and changing the system. So in the decision maker, in this design, it's really important, as I said, to design solutions for the people who are experiencing the problems the most. And that's what we are talking about today, the human-centered design thinking. So already questions about this part, then raise hands so I can answer them. This is a good example of a design that's made with a really good thought. There was a vision behind it, but it was not done in the right way, because when people started using it and prototyping it, it failed. Does any one of you know someone who's wearing a Google Glass? And it seemed really nice when you heard of it the first time. So what went wrong? They didn't ask the people who were supposed to use it, and also the people around them, how it was going to be. So with Google Glass, you can see everything, and they record it as well, or it's possible to record it in the meantime. And it had a lot of struggles with privacy, and especially not people wearing it, but the people around it. And they really missed out on that while they were designing, so it failed. This is also a really good example. They were designing a path, and they didn't ask the users, and they didn't test it with users. And what do users do? They make their own path. So the stairs are not used. And probably you see this all around you. People using stuff, tools in a different way they were supposed to, or there was this really nice invention and it never came into market. And obviously, if we are starting to design prototypes during the hackathon, we want to make things that really work. And sometimes it's really easy. Just turn it around like this. Who of you know the tomato ketchup before it was upside down and you wanted to take the tomato ketchup out? It was always a struggle, and then you get this whole flop of tomato ketchup on your plate. And they were not designing, they were just designing the project, the tomato ketchup and the bottle, and it was old fashioned. And then they asked the users and how they experienced it, and connecting with the experiences and flipping the design process around. They actually flipped the bottle around as well. And they're now squeezing it and it comes out easily. And it just seems really easy, but it's actually really difficult to, in your design process, keep on reminding the end user. So this is the process of human-centered design. And the first step is, I think, and I believe, the most important step. It's the empathize phase. So understanding your audience. And I have this really great example. It's from Thomas. Thomas was also helping us out in the last hackathon. He's a human-centered design director of an international company that designs social solutions in Africa and Asia. And they had a assignment to design something in Kenya in vision care. So there are a lot of people over there that don't wear glasses, but actually have really bad sight. And it's not good for healthcare. It's they make a lot of accidents in traffic. There are so many reasons why you don't want to have people with bad sight in your society without glasses. And they went into the country and just looked at the people. They went to the people who have bad sight. They tried to look for them. Where are they? They couldn't find them because no one is tested. So they thought, oh, maybe it's about the test. So they experienced it the whole way. They observed it, they interviewed it, they went into the countryside and did their examination to understand the audience. What's their problem and why don't they get glasses? If you know what the real problem is and you understand your audience, then you define the solution, define the question. So which question, which problem do we have to change? Then you start your ideation process. So you brainstorm and you create lots of solutions, as many as possible. And from that, you start picking one or two that you want to take into prototyping. So you build a representation of one or more ideas and you start prototyping. And prototyping is actually building something. So if you are making an app, make a test app, or build a little machine if you really want to. And then you start testing it. And the test phase is also really important. So with the stairs, if they would have tested the stairs and they would find out that people were walking on it, but if they tested it in real life, then they would find out that people were going around it. And then it wasn't a good stairs. We're going to start with the empathize phase. A few ways to do that, to really be able to understand your audience, is to observe them. So maybe go to a market and look at your audience if your audience is walking around there. Or for example, if you have a person with diabetes and you want to make a solution for their problem, for example, the way they measure their glucose, ask them one day if you could join them during that day, the whole day, and see what they are doing, take every step of that. Immerse yourself in their lives, interview them, take research, or track them. That's also a way of doing it. It's you can draw it down. So what are the steps they are taking every day when they experience the problems? And a very fun way of doing it, and also a really important way of doing it, is asking the why. So you have a problem and you ask why, 5 times. Don't stop at 2. Don't stop at 4, 5 times at least. Because the more whys you ask, the deeper you go into the root cause of the problem. And only if you know the root cause, you can find the real solution. So we're going to try this at home. I'm going to ask you to do a little bit of empathize phase. So we have 4 cases. We have people who need a corona vaccine and they can't read. How do we reach them? What's their problem? How do they get to their vaccination station? Another case is you're young and you're lonely. What do? Chronically ill and digital care. How does that work? Or e-bikers who make accidents. There are many of them, way too many. And they all have a problem. And you're gonna try out how it is to find the problem. And the way of doing that, we're gonna give you in the chat. We're gonna put you in breakouts. So we're gonna make little groups. And with your little group, we're gonna give you an empathy map. And it's in the chat, it's shared. And you can see 7 questions here. This is your person you are empathizing with. And the first question is, who are we empathizing with? Who is the person we want to understand? And obviously, you're probably not going to find out in this little 10 minutes, but it's just a way of going through these questions and talk about it. Do we know a little bit more about these people? What is their role in the situation? And what do we want them to do? What do they need to do? What's the change they have to go through? What is it they see? What is it they say? What is it they do? What is it they hear? And in the end, what is it they think and feel? And the last questions are really important as well, because lots of times we skip the feeling and thinking part, so the inner part. We only observe what we can see from the outside, but there's also a big inner world, and the inner world is mainly what we're not talking about. So what are the fears and the frustrations and the anxieties? What are the gains? And if you can't answer these questions, for now it's no problem, but when you start designing, you really have to challenge yourself to make sure that you can answer these questions. So I'm gonna look at Geertje Marije. Are we grouping the people ourselves, or are they choosing a group?
We're going to group the people automatically.
Perfect.
And in the chat, we've put the power to the people empathy map and the 5 groups, the names of the 5 groups.
Perfect.
And I can make out the break homes now.
Yeah, we're gonna give you 10 minutes. So we're gonna count down if that's possible, or we're gonna make sure after 10 minutes you come back here, and we're gonna share experience a little bit, because I want to hear if it's easy to do this or difficult. How does it feel to really try to get into the skin of the person you are trying to find a solution for? Have fun. Can you share your experience a little bit?
Yes.
How was it to do this?
It was nice, and I think it was nice because we had different. So what is Sylvia is from Portugal, so she's currently in Portugal. So we talked about literacy from the Dutch perspective and the Portuguese perspective, but also that it's way more complex than people just not knowing how to read, for example, Dutch or Portuguese, but that it's also different languages and reaching those target groups, but also digital literacy. So yeah, we didn't get really far because we realized that I don't know, it's way more complex than what you think it is once you start talking about it.
Yeah.
So yeah, it was a really nice discussion. Yeah.
Good. That's good to hear. Someone else from a different group, Suzanne, how did you experience it?
Yes, yeah, we were in the same group. We had this problem about youth and loneliness, and we're trying to figure out what exactly their problem is, and we wanted to solve for them. So yeah, it gave me a bit of an idea how it is to go in that thinking about the problem and what way to choose to solve the problem. So yeah.
Yeah. One more, Dominique.
Yeah, we worked on the idea of e-bikes and problems with falling. So we focused, the first problem was, who are we focusing on? So there are many groups that use the e-bike at the moment, and who is the group that is falling more, or especially if you pick the group as a whole, you have to need different ways to get to the people, to persuade the people, and to get to know your population. So we focused on the elderly because that's the group that, as far as we know, has the most problems with, at least when they fall, and then you hear the most of falling from that group. So I think that was the biggest issue, to get to know our population and to get to the idea about why are they falling.
Yep.
Just to get to your solution.
And probably you also experience that it's really difficult. You have to make assumptions. If you want to solve their problem, you have to make assumptions. And that is actually what we try not to do when we're using human-centered design thinking. So we had so many questions. I'm going to speak for my group as well. We had so many questions we couldn't answer ourselves. We just made an assumption to go into that process. But actually you want to find out who are these people, where are they, and you want to ask them yourself. Maybe was that also something you experienced? Yeah. And because we usually start with the problem, most of the times you have a solution, or you have a solution in mind for a problem you experience, and you already thought, well, this is how we need to solve it. And I think Geertje Marij, you gave that example yourself for the younger people who are lonely.
Mm-hmm.
That you made a solution, but you're not actually sure if that's the solution for the problem.
Yeah, we made a flyer to let the young people know that there is a walking room. You can have a conversation with a peer about your problems. And we made a flyer, but the design was not correct. The people, the youth, didn't like the design. It was too childish. So that was, an example of not knowing the group of people you're wanting to help.
Yeah. So I think that's a really good example where how important it is by every step you take into the design process to really stay in touch and get in contact with your end users. So this was the empathy map. I'm going to go to the next phase in the process. Thank you for Geertje Marij for your example again. I'm going to go back to the whole this roadmap. So what we just did was just a little exercise to get to know your audience, and as I said, it's really important. Only by knowing your audience, you can define the problem and you can really start finding solutions. So next step, if you know the problem and you really have the root cause, then you can only start brainstorming for the solution. And there are a few rules if you start brainstorming. And you see this this little picture of your left brain and your right brain. I think newest research showed that there is no theory of left brain and right brain that says that you are more creative if you're a right brain person, but I think it's still nice to show this picture. But creative processes usually they ask for different situations. So if you are behind your desk with your computer, it's way more difficult to find a good solution to a problem than when you're walking outside into a park. Maybe you experience it yourself, but your mind starts working differently. So there are a few rules that stimulate brainstorming and ideation. So no use of devices is something I really try to keep in mind constantly when I brainstorm for ideas. Don't criticize the ideas of someone else. Every idea is good in the basis. That's a starting point. Write or draw everything down. I draw everything. I have books everywhere and I'm drawing all the time. Go for quantity, not for quality. So it's not the best idea you're searching for many ideas, many, and build on ideas. So if you have one idea and it's probably not the best, then you have a different one and a different one and a different one. And we're gonna quickly practice it ourselves. So maybe you have a piece of paper like this, A4, maybe smaller, and you fold it once through the middle, again, and again. I'm blurred, so it's different. So what you get is 8 little boxes on your paper. We're going to give you 8 minutes. And you started empathizing with your group. with the audience you were empathizing with. So in one case, it was the young person with a question, and the other person was a situation. It was an e-biker, and it's not perfect, but it's just an experience right now. I want you to draw a solution on this paper. Every box, one drawing. And every minute, one box. In total, 8 minutes. And in the end, we're going to have many, many, many solutions. And one of them is going to be the best solution ever. We're not sure yet which one it is. And it doesn't matter if it's not yours. It doesn't matter if it's not the first. It doesn't matter if it's perfect. But one of the solutions is probably really a good solution. So we're going to give you 8 minutes. And it sounds really strange to now practice finding a solution. You don't even know the problem really clear yet. Just keep something in mind and give yourself the time to start drawing. And it maybe feels awkward, but awkward is good. I'm going to start the timer and you're going to start drawing. And in the end, after 8 minutes, I want to see your papers and I want to see actual drawings. Is that okay? We can start. I'm going to take my timer before I forget.
For
And
our
every
group, sorry, for a group theme or for one theme general?
You can start with the group theme you were in and use that one. But you're going to do it personally, just by yourself. You're going to draw it just by yourself. Yeah? Geertje, Marije? Clear? I saw you talking to each other.
Yeah. It's true. We were wondering what problem we would like to tackle.
Oh, you can choose. You weren't in a group.
Yeah. We will.
So I'm going to start the clock now. 8 minutes start counting, and every minute I'm going to say change. Okay?
Cool.
Change. 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 Almost there, change. Change for the last time. And a few people are ready. So finish up almost your last drawing. And show me what you've got. Woo! Look at you guys. So many solutions. Who wants to share something, how this was? How was the experience of drawing just 8 solutions in such a quick time?
Yeah, it was like my brains were getting, how do you call it, when you do the laundry and you're
squeezing
the water out.
Yeah.
And I made it 8 times to squeeze a solution out. And I was not sure I could do it, but I can do it. So it's good for your idea of being creative.
You thought I'm not creative enough to find solutions.
Now 8 solutions, no.
You did it.
Someone
else an experience that want to share? Mia, tell us.
You tend to fall back to ideas that already exist and not maybe implemented to the maximum potential. And the idea of creating something totally new in 1 minute time, every time again, is more difficult.
Yeah, we didn't say it was easy.
No,
but if you do this with a group, you have 8 times so many solutions. Oh, I get a little girl into my room. She's so cute. She's disturbing a little bit. No, it's okay. But you get so many solutions. One of them must be right. So once you have so many solutions, you're going to go to a different phase and you're going to select 1 or 2 or maybe 3 solutions that you want to build into a prototype. So that's the next phase of the, I'm going to go back to the PowerPoint again. That's the next phase of, look, here she is. You want to see her?
Yeah, I see her.
You see her as well. Ja, mag je beneden doen, oké? Yeah. She wants to have an envelope. She's writing a letter to someone. Je mag de onderste laag gewoon open doen, schat. Zoek maar iets uit. Ga maar kijken. So this is the prototype phase you're going into. It's the building a prototype of your solution you chose. And there's also a useful way to selecting the best solution to prototype. And that's there are all kinds of canvases you can find online. There are tools, so many tools to find. But this is a canvas that can help you identify the solutions that are most valuable, that are most that are the best to start prototyping. And after you prototyped, you're going to test it, and that's also what in Geertje Marij's example of the design of the leaflet they made. They forgot to test the leaflet before they printed it for so many hundreds of people to show it to one of the audience and ask, is this also a leaflet you want to read, and does it really answer your questions? So that's what you do all the time. You make something and you test it and then you adjust it. So that's a really important part of the human-centered design. I'm almost done. It's only a few minutes left, so I'm going to quickly give you 7 lessons. I really experienced, so these are my own lessons. Make sure you have maximum insight of the problem. Always go deep, 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 deep. 5 times why. It's, do you really know who's your audience and what's the problem you want to solve? And make your problem not too wide, but also not too narrow. So we were talking in our group, the young people who are lonely. If you want to solve the problem that you really want to cure them, that they don't feel lonely anymore, well, that's a huge problem to solve. So you cut it into pieces. Make sure it's not too wide, but also not too narrow. Focus on your audience. Focus on your audience. I can repeat that over and over and over. All ideas are valuable. Test and adjust. Learn and fast adaptation of the lessons you learn. Make your team as diverse as possible. That's also something that I think Nasha mentioned, and also Vanessa. During the hackathon, we make really diverse teams because they have different solutions in mind, and they have different perspectives on the problem, but also different solutions. And also, I think it's really important to have fun while you're doing it. And the people who once experienced the hackathon will say that it's so much fun to join and to really go into this process and experience and learn and behave like Alice in Wonderland and constantly discover new things and learn and have fun. So this is all I wanted to share with you. A really quick insight into the theory of human-centered design and a few lessons of how to use it in practice. And I hope that this is giving you some little tips and tricks you can use tomorrow, maybe even in your work, or when you try to find a solution to a simple problem in your household. Maybe it's also possible. Thank you for your time. Does anyone have a question or something they want to share or to say?
I saw one question in the chat for you, Frederike. It was regarding the ideate phase. The person was wondering, is there any theoretical aspect of the ideate phase? Because right now it feels very like a creative phase.
Yeah, the ideation phase is a creative phase. So once you have your problem really set up, so you know exactly what the problem is, you start finding solutions. And that's actually your creative phase. You have to find different solutions. And once you have a solution, you can start making it technically. So you can transform it in how does it actually look and what do we need to do for it. And if you skip the creative phase, then you might end up falling into really specific. So if, for example, if you are focused on finding a solution that's in an app, then you're skipping the ideation phase and you're going too fast to a prototype. So yeah, it's basically just brainstorming, getting all the ideas that are possible, and then selecting them.
Okay, very clear.
Did I answer that question? Was that an answer to the question?
I think it was. It was very clear. So thank you very much. And thank you for your interesting workshop today. I think a lot of people now have a small taste of how we work at the hackathon as well. So how important it is to think about different perspective and ask yourself the question, why,
yes.
why? So
why? You skipped to
why?
You forgot to.
Very important. So thank you again. And let me see, there was one final question regarding the event itself that I would like to talk about plenary, because it's about the registration for the event, how it works. So how can you apply for the hackathon, and what does the subject has to be about? So regarding the pitch, so you can register for the hackathon starting the 1st of August. You can do that via our website from Hacking Health Amsterdam. And the pitch subject can be about almost everything. It has to do something with the happiness or the health regarding regular citizens, how we can improve that, but we don't have any other restrictions that you have to take into account. So please be very creative about it, don't hesitate, and you can always contact us if you're not sure if you can register for it. So please let us know. And in the case that we get too many applications, we might have to select a few pitches, because definitely due to Corona as well, we might have a limited space for people. But again, don't hesitate to contact us if you have any questions. Hopefully we'll see you all very soon. So thank you everybody for joining us today, and hopefully we'll see you at the end of October. Okay, thank you, enjoy your night.
Thank you.
Bye.
Thank you.
Thank you. See you in October.